Are you thinking about moving to Canada? Well, let me tell you why you should move to Canada. First of all, we have free healthcare. So if you ever get hurt or you're really sick, you can always go to the hospital with the peace of mind knowing that you won't have a massive bill to pay.
Canada has free healthcare for everyone. Well, not exactly. Canadians love to say that our healthcare system is universal. The truth is, about 30% of our costs are paid privately, and many essential services aren't covered at all. So why do many of us believe that healthcare in Canada is 100% free? Well, it's because of something called truthfulness. We believe that the idea of something is true, but it's not factually accurate. We often compare ourselves to the US, where insurance is a must and healthcare is really expensive. So it feels like Canada is a paradise of free medical care. But when we look at the facts, we see a way more complicated picture. So what does Canada's healthcare system actually cover then? Let's figure out the truth. Under the Canada Healthcare Act, all residents must have access to medically necessary and physician services without paying out of pocket. But here's the catch. The Act doesn't define what medically necessary means. That's up to each province and territory to decide themselves. That means that if you break a bone, the x-ray and the treatment are covered, but if you need prescription painkillers afterward, that's on you unless you have private insurance. Now you might be thinking, okay, but at least emergency care is always free, right? Well, not exactly. Hospitals must treat emergencies, but if you don't have provincial health coverage, like international students, temporary workers, or visitors, you can still get billed after the fact. Even for Canadians, emergency room visits aren't always free. In provinces like Ontario and BC, uninsured patients can be charged for ER visits, diagnostic testings, and hospital stays. So while hospitals won't turn you away in an emergency, don't be surprised if you get a bill later. Now here's some good news. Not all hospitals bill the same way. For example, Michael Garron Hospital in Toronto offers financial assistance programs for people who can't afford to pay. But these programs aren't available everywhere, so if you're uninsured, it's always good to check before seeking any treatment. Now here's something that might shock you. Even if you're insured under your province's health plan, that doesn't mean that everything's going to be free. For example, in Ontario, an ambulance ride costs $240 if you're insured. And if you are insured, you'll still pay a $45 copay fee unless it's deemed medically necessary. Most prescriptions, not covered outside of the hospital. And if you want a private hospital room, that's also extra. Have you ever been to a doctor and they've asked you to pay? That's because not everything is covered. Some services like virtual telemedicine services, certain vaccines, and even getting a doctor to sign a sick note all fall outside public coverage. And if you don't have private insurance, you're going to be paying out of pocket. In fact, around 67% of Canadians have some sort of private insurance, mostly through their employer to help cover things like prescription drugs, dental work, and vision care. So here's the big question. Should Canada allow more private healthcare options? Some argue that private clinics should reduce wait times and give people more choice. Others worry that it could lead to a two-tier system where the wealthier get faster and better care while lower-income Canadians are left behind. Public opinion is shifting. Recent polls show Canadians are more open to private options. But is that the right move? That's something we all really need to think about. So is healthcare in Canada truly free? The truthiness of the statement makes it sound like it is, but the truthfulness tells us that healthcare is a mix of public and private funding. While hospital visits and doctor appointments are covered, many necessary services are not. So what do you think? Should Canada move toward more private healthcare options, or should we fight to expand public coverage? On that note, thank you so much for watching. Comment down below what you think. And if you're ever wondering or questioning if our healthcare system is 100% free, come back to this video and you'll know the truth.